In this edition of The Buzz of Madison County, many small businesses have suffered at the hands of the pandemic this year because of mandated safety guidelines and customer reluctance to visit public places. Well, another sector of our society has been negatively impacted as well, but it's because of a shortage of people to fill jobs. Home care and nursing vacancies are tough realities for organizations and facilities providing those services. The shortage existed before the pandemic, but it's even more of a problem now. As a matter of fact, a Georgetown University study projects that the economy will create 1.6 million job openings for nurses through this year. They project that the nursing workforce will be facing a shortfall of roughly 200,000 professionals this year. The causes related to the nursing shortage are numerous and are issues of concern. We spoke with Madison County resident Beth Bright, who is a nursing supervisor at a small long-term care facility, about the shortage. She says while the shortage isn't new, some of the factors contributing to that shortage may be.
Unfortunately, it's the norm. However, the coronavirus pandemic has not helped that situation any because, as you well know, back in mid-March, late March, not only were the skilled nursing facilities, being closed down to visitation, but schools as well were closed. Daycare centers were closing. So a few of our nurses have school-age children. When the school's not in session and the daycare centers aren't opened, then our staffing challenges rise even higher. We have nurses who are struggling to find childcare. Many times they're unable to find child care, which again then creates additional stress because they're not coming in, so the day shift nurse is stuck there, and it's been a trying time.
Beth said that in spite of the shortages, she appreciates the hard work and commitment of the nurses that she works beside every day.
We have been very fortunate at our small little facility. Our keys to success has been the flexibility, commitment, the patience. We've supported one another. We have encouraged one another. We literally went into this. We locked arms and we took the head-on approach and we said, we're going to be successful. And we have been. We have not had one positive case. Praise God.
Mary Melton owns and operates Legacy Home Care, providing home services to the elderly and disabled throughout Madison County. She says the demand for home care services is up even more now.
Because people do want to stay home and they do want to stay safe, and getting out and about is incredibly difficult for some of our seniors and disabled people. And because they are, elderly and disabled, that puts them in a higher risk category for COVID and other health concerns.
While a number of factors contribute to the shortage of home care services, Mary told us,
we have seen a decrease in applications for people wanting to be caregivers. And I think that is just because they might be concerned or afraid to provide caregiving services, whether they be homemaking services to elderly or disabled or more of a skilled service. But honestly, home care is probably one of the safest venues there is because we take care of shut-ins and elderly and disabled people who aren't getting out and aren't exposing themselves to COVID. So, and with proper measures for home care, masks and hand sanitizers and gloves and universal precautions, I feel like home care is providing some of the best care where it's needed most.
Mary said she hopes that her comments will encourage more people to feel led to become care providers. As we continue to navigate through these unknown waters of the virus, it's worth remembering what our trusted friend, Dr. Thomas Short of Community Hospital Anderson Emergency Department, had to say to us in a recent interview.
I think the main thing is to reiterate how important it is to wear a mask when you're in public. And that's a twofold thing. It helps protect you somewhat, but it also prevents you from spreading the virus to other people if you have the infection and have not yet become symptomatic. And the second thing is to just be meticulous about hand hygiene. I can't understate how important it is to wash your hands, to use hand sanitizer, to be meticulous about not touching your face when you're out in public if you haven't had a chance to wash your hands. Those things are very important.
We express our gratitude to those who continue to serve, taking care of those in need of care. Our thanks to Beth Bright and Mary Melton for spending a few moments of their valuable time with us to share their insight. Support the small businesses in your community. Your community's future, more than ever, now depends on it. Look us up on Facebook. That's the latest buzz in Madison County.